Good afternoon, everyone. I want to welcome you to our special edition of Kankakee Chats this month. We have Dr. Kalisha Hill, and we have been trying to bring a special guest on for our residents just to talk about relevant topics. And as of late, of course, that has been COVID-19 and how we all are coping with COVID-19. So in the past few weeks, we've been receiving some questions specifically from women as the schools closed and women are now trying to work from home and homeschool and do a number of things. And so some of the women in the community have started reaching out to us, asking about resources and, typical signs they should look for with their youth. To see if they're in any type of trouble and just trying to help them cope and manage through this whole pandemic. So May is Mental Health Month, and we are very fortunate to have great partners in our community. You've heard from some people from Riverside and Aunt Martha's, and this evening I'm bringing you a special guest from AMITA St. Mary's Hospital, Chief Medical Officer and Laboratory Medical Director, Dr. Kalisha Hill. And I want to say welcome to you today, Dr. Hill.
Thank you for having me.
So I'd like to start off, first of all, what made you want to go into medicine? How did you know this was your calling?
Well, I think as a child, like many children, there's an innate desire to want to help people. And you try to figure out what the best way is to do that. And I was fortunate enough to have a grandmother that was actually going back to school to be a chiropractor in her 40s. So as a child, she would take me to school with her. And sometimes I would get to see the specimens, see the students working on various aspects of science. And my parents were in the medical field as well. So it attracted me very much. And then once I actually got into college and decided to go to medical school, I determined that the best way to help people, it was through laboratory medicine and pathology. So It was pretty much a linear track for me.
Okay, where are you from, Dr. Hill?
I am from here. I'm actually from Chicago. I grew up on the south side and then moved to the south suburbs. So I'm pretty much been in the southland of Illinois since I returned home from college.
Okay, and where did you go to college?
Emory University in Atlanta.
Okay, very good. So you all have it. We've met Dr. Hill. Again, want to welcome you. We are going to start off by asking, how do you believe the pandemic is contributing to mental health?
So I will have to say that it's happening twofold. I think the most obvious are the negative impacts. The first being just the most obvious, and that's the loss of loved ones and friends. And I've seen that happening in our community. I hear it from my neighbors and from other parents that I know. Just the biggest concern is loved ones who we know have comorbidities that are at risk, and we're worried that they're going to get sick. And then some people have already gotten sick and recovered, which is fantastic, but we have had some loss of life as well. So I think, to me, from what I'm seeing, that's the biggest worry. The second worry, of course, is the financial strain. I feel that we were making good progress with people really expanding in the workforce, various jobs that were becoming readily available. And now we've had a bit of a setback financially with businesses having to close. And then the third item, which I think has negatively impacted, is just the strain of being at home and the stress that can put on dynamics in the home. The increase in domestic violence, the stress of trying to do many things in the home that normally you get a break from your loved ones just by going out into the workplace or going out to school. So those are kind of the obvious negatives, but I like to, in everything I do, is focus on the positives. The positive that I saw first and foremost was the obvious glare in some of the gaps in healthcare. I think it showed a light on it. And I was just very happy to see our hospital and our health system react immediately and work as a team to fill those gaps. And hospitals across the city and across the country had been doing that. I think it was most evident in New York, and having that response to see the need. If something happens, are we prepared? And the answer was no. And now I don't think we'll ever allow ourselves to be unprepared again, because it brought some tumultuous times for us. The other positive was just people, as they're at home, they have been seeing this time as advantageous to really focus on hobbies, do things that you enjoy doing, and spending time with loved ones. Oftentimes when we're working all the time, we don't see our loved ones as much as we'd like to. So that's been a positive as well. And then also just taking time for yourself, finding those old hobbies that you put down years ago and now you actually have time to do them. A lot of people, whether it was getting better or getting more involved in gardening and doing things that they used to do that they may not have had time to do when they were working full time. So those are some of the positives that have come out of this. I hope people recognize that as they go back into the normal workforce, that they recognize that they should take time to take care of themselves.
One of the things that you mentioned were gaps, and since we want to give a local perspective on this, we are fortunate to have 2 hospitals in the city of Kankakee, especially for a population our size. We have about just under 27,000 residents at the last census count. And so when you talked about gaps in our healthcare system, what are some gaps that were identified once COVID-19 hit Kankakee County?
The number one gap I saw was we did not have a process in place to separate. And that wasn't even just in hospitals, that was in nursing homes, it was in group homes, it was in prisons. That was the number one gap. And we were fortunate enough, again, I very much am a proud Southlander. And because the virus took some time to reach us, here at our hospital, we were very much prepared by the time our first patient hit. So we had already identified our wings. We had brought in equipment and had our facilities team working on negative pressure rooms. So we had enough capacity to care for patients. So by the time we set up our command center, got our testing set up to be able to test patients, had an app and temperature gauges to screen people as they come into the hospital. By the time all of that was set up, we were ready for that very first patient, and it made a huge difference. Okay.
Of course, depression and anxiety have increased due to social distancing, according to the latest health reports. I was speaking with one of our city council members, and she said for us huggers, this is really hard. A lot of us, Kankakee has a lot of families that have been here for generations, and so you went to school with someone, their parents, the grandkids. So there's a lot of very connected families and people in our community, and so social distancing has been a challenge for many people, particularly those people who are outgoing, who are social, who like to interact with other people. How can we combat the depression and anxiety that comes from the social distancing that we now have to follow?
Yes, the first and foremost thing that anyone can do is any signs of change in mood that is consistent, reach out. It's important to have someone to talk to. If possible, talk to your physician. If it's diagnosed severe enough, you may get a referral to talk to a professional like a psychologist or a psychiatrist. But before you get to that point, again, focusing on the positive, you want to be preventative. So the simplest thing we can do actually align very well where we are as a culture, and that is social media and our ability to communicate constantly through social media, as well as mechanisms like Zoom and FaceTime. So what I have seen that is successful for many people and many families is designating time at least once a week to FaceTime as a group. For example, my sister just had my nephew a few weeks ago. Every birth of every kid in our family, everyone is at the hospital. No one could go this time. So it was very sad that after 3 weeks, I still haven't met my nephew. But when she was in the room, she FaceTimed so I could see the baby. And, we've had multiple people on Zoom so the family members could see and talk. We did that on the holidays. And then more importantly, those daily check-ins with people who don't have a lot of interactions, like the elderly, your grandmother. I have a great aunt that's 95, and she's spry and can remember what she did yesterday and 40 years ago. So I make a point of reaching out to her and talking to her more often than I did before. So it's knowing that you're in constant contact on some level daily with those that that you're very close to, like your mom or your dad, and your children, of course, if they've moved out of the house, and then that extended family, trying to have touch points at least a few times a week or at least once a week, I think will make a difference.
I think that's a great idea. Mother's Day recently passed, and we know that our fathers, our dads play a big role in our families, a very important role. But oftentimes, many moms are taking on multiple roles in the home. And so we talked a little earlier about, moms that are working from home. The kids are now home, so they're trying to make sure the kids don't fall behind on schoolwork. They still have to continue, the chores, grocery shopping, laundry. The list goes on and on. So what advice do you have for mothers that may be experiencing a harder time right now? And I know for moms, I remember when I was a new mom, you want to get everything right and be perfect, and you feel like if you can't do everything, that you're a failure in some type of way. And so if you could speak to that for us, I think that would be really helpful for our residents.
Absolutely. I think we've all embraced the concept that women are just natural multitaskers. And I've read a lot of studies about how multitasking isn't really effective and you really should do things one by one. The reality is that is not our reality, especially as mothers. So my mantra has always been embrace it, own it, and do what you have to do to get through. So the two things I think that are most helpful is to be patient and forgiving, not just with your children, not just with your significant other, but with yourself first and foremost. You are not going to be perfect. I am not B. Smith, not Martha Stewart. Julia Childs can't teach me to, cook a gourmet meal for my family every day. It's not going to happen. So you do the best you can, and you do it with love, and you do it with patience. And the second thing I think that is helpful is for people to just lower their threshold for gratefulness. We have a tendency in this country to want everything now. We don't want to wait for anything. We have to recognize that at any given time, you have to adjust what your priorities are. You have to adjust what's important to you. And you have to really be grateful for the little things. Be grateful that you have a roof. Be grateful that you have food. And be grateful that you are able to actually be at home and teach your child. You may not have the latest and greatest computer or, a private tutor coming to give you Skype lessons, but the mere fact that you're able to spend time with your child, teaching and conversing and doing the best you can. We're not Einstein as mothers, but we have life experience that we can share with them. That one-on-one time, to me, is more precious than even the content. So just enjoy it, embrace it, and be grateful.
What can we do at this time to help our children cope? A lot of our children are missing their friends from school. They're not able to play and see their best friend and hang out with the people that they're used to seeing every day. So what can we do to help our kids cope during this time?
Yes. So number one is exactly what I said for us to do for ourselves. When you're reaching out to people, include your children so they can FaceTime with family and friends. Have them call and talk to their friends on a regular basis if possible. If they're working on schoolwork, they can talk about assignments together just so that they have that touch point with other people, even if it's not face-to-face. Structured play is always good, whether it's inside or in your backyard or on your front lawn. And also puzzles, I've heard, and my own experience in my home, people love puzzles, and they're a good way for children to work on their critical thinking skills, as well as something that's fun for the family. So indoor games, puzzles, outdoor play around your home is very important, and making sure that they get good exercise and activity.
Okay. So we have a couple people that have stopped by to say hello. Looks like Elizabeth and Sophia. So hello to both of you, ladies. Thank you for stopping by. If you're pregnant, Dr. Hill, what advice do you have for expecting mothers? It's already, especially if this is your first baby, it's a very scary experience. It's new. You don't know what to expect. Things can go wrong. But now you are pregnant during a pandemic. So
Yeah.
What advice do you have for expecting mothers?
I would say first and foremost, be very careful with your contacts, because if you're pregnant now, I anticipate that we'll be all resuming activities in the future. You may be going back to work. Be careful who you're interacting with. Make sure you're social distancing. Make sure you're wearing a mask. Some people wear gloves. Just do whatever you can to protect yourself when you're out. Secondly, making sure that you eat healthy and exercise. The COVID virus is primarily a lung virus. It infects other parts of the body, but the primary painful symptom is breathing. So by exercising, you're actually increasing your pulmonary function, or how well you can breathe. So that can be a very important thing to do. When I was pregnant with my twins, I did my aerobics exercises literally up until the third trimester. And then once I was too heavy to do any kind of aerobics, I started to swim. And I swam literally up until the day that I went in for labor. And it was very helpful. And I think, and I've always recommended to my friends to just keep active when you're pregnant. It can make a huge difference. And making sure you're eating healthy. It's very tempting when you're pregnant to eat a lot of your favorite foods, which I think is great. But my mantra has always been everything in moderation. So whatever healthy plate chart you follow, make sure your vegetables are primary. You pretty much minimize to eliminate fried foods, and try to use protein sources that are not so meat heavy. And so that would be my recommendation.
Okay. Of course, we have all kinds of experts on social media. We've seen a lot of comments on social media. Is it true or false that moms-to-be give birth alone in the hospital during this time? Can you provide some clarification? And before you answer, we did have a question. This was actually a question we had, but Crystal Moore Cole asked, can you please elaborate on the policy for labor and delivery right now? I was told my husband is not allowed to be with me until I'm admitted and in active labor. Are mothers being forced to be tested who have no symptoms and have not been exposed? What if we refuse testing? So I know there's a lot of questions in that. So let's talk about moms to be giving birth alone in the hospital. What is the policy right now, the standard of care for moms coming in to give birth?
Okay. So at St. Mary's, everyone is screened, and screened is different from testing. So a screen is that you do a temperature check, and you ask about symptoms, and we do COVID testing, and we do that for all of our patients that are admitted. Now, if you're coming in for a well check and you're not being admitted, if you're not in active labor, no testing is necessary.
So let me stop you there. So can a person refuse that test?
That's a very good question, because frankly, I haven't seen that happen. Everyone wants to be tested at this point, particularly if you're pregnant and you know that you're going to give birth to a baby. I think you would want to know your COVID status. Okay. So we've not had that happen. But the goal would be to have that testing done so that by the time the mother leaves, we have the result and they can go home confident of what their COVID status is.
Okay. So Crystal said that she was told her husband is not allowed to be with her until she's admitted and in active labor.
Yes, so once you're actually in active labor, then your husband or your significant other or your labor partner can come in with you when you're coming in to actually go into labor, and they are to just mask. They don't get tested, they just get a mask, and they're asked to stay with the mom through the entire birthing process, so they're not coming in and out of the unit. And then once that's completed, they are with them through the whole time. So yes, that's a very important component of that. I think for all of us as moms in labor, it's so important to have that support person with you when you're in labor. Many of us have to go to the hospital before we're actually in active labor. And at that time, you know, I wouldn't require my husband to be with me while they're just checking me to make sure I'm okay and then sending me home. But once I'm in labor and I'm actually going to that, you know, moment where have a little bit of trepidation, I want my support person there holding my hand.
Absolutely.
So, yeah.
Absolutely. How does mental health directly impact physical health?
So that is a question that goes both ways. I think your mental health affects your physical health, and your physical health affects your mental health. So that's why the three components that I think are important for all people for mental health is that triad that I call mind, body, and soul. For your mind, no matter what you're doing, you want to make sure that you're involved in activities that you are constantly stimulated, something that interests you, something that you're passionate about. And more importantly, I think something that you're doing that contributes to not just your improvement, but the improvement of people around you. And many people have that satisfaction in their workplace or in their social groups or in their civic groups, things that you know that you're making an impact for others. And I have seen in the Southland and in Kankakee County, the citizens are very active in improving the community and reaching out to help. The donations to the hospital has been tremendous. So that in and of itself, the mental satisfaction of knowing that you're doing good and knowing that you're learning and growing every day as a person is the number one. The body is the exercising. Whether you're a walker and you love your elliptical, you like doing Stairmaster, you like to run, whatever your exercise of choice is, do it and do it consistently. Many of us, our stress release is actually exercising, and that is the most important thing you can do for yourself, because not only does it increase your endorphins to make you happier so that you're not feeling those symptoms of depression and mood change that can fluctuate, but it also is healthy for your body in terms of your health and making sure that you're in optimal condition so that you're not getting sick. And then your soul, whatever your spiritual guide is, it's very important that you're recognizing that you are empowered and stronger beyond yourself. And I think that gives a lot of people comfort to know that they're not in this alone, beyond just the people that they touch every day. And so I think that's very important for people to have that enrichment as well.
Okay. Some people would believe they can't seek services right now due to COVID-19, such as an annual checkup or procedure. I know when this first started, many of the hospitals had canceled like elective surgeries and those types of procedures because they were trying to protect capacity, so that if we had a surge in the community, they would have the beds and equipment and gowns and such needed to take care of the community. Some people still believe right now that they can't seek services like an annual checkup. So where are we at? What does that look like for us right now here in the city of Kankakee?
Okay, so here at St. Mary's, we did a phase 1 reemergence that started on Monday. So we started scheduling elective surgeries as well as some of the other services like in cardiology, mammograms, other radiologic services, et cetera. So the goal with pretty much anything that's outpatient, we're back to normal business. With our elective surgery, we are scheduling. We actually opened up our blocks for the month of May so that our surgeons could get their patients in whenever they could, because many patients were waiting. And for many of us physicians, our sole driver is preventative medicine. And to have patients waiting at home, not be getting their screening, not getting the testing that they need, was very concerning. So very happy that we are now able to have people calling in scheduled. Anyone can get their annual checkup. We actually are doing telehealth visits And our AMITA Medical Group are doing that. And I know everyone can just look at myamita.org and find a doctor if they don't have one. But most people know the physicians in our community and can schedule their telehealth appointments. And if they actually need a physical exam, when they're having that conversation with the physician, they can schedule an in-person visit as well.
Okay. What questions should we specifically be asking our primary care physicians at this time?
And that's a good question. To me, it's more important not what you ask your doctor, but what you tell your doctor. Please, if you have any symptoms that are different from what you normally experience, share, because you may not think that they're a big deal right now, but your healthcare provider can listen to your symptoms and may identify something that you have not thought of. So tell them how you're feeling mentally, tell them how you're feeling physically, any new pains or concerns that you're having. Just as important, describe your home life. If you're feeling that, you're in a home and the situation is becoming tense, where you're at risk for domestic violence, share that as well. So I would say the most important thing is to tell your doctor what's going on with you and be honest about your feelings and what needs you may have.
Can you speak to us about specific programs and services that AMITA St. Mary's offers for the community?
Yes, so we are a full service hospital, so we have all screening modalities, whether they're cardiac, whether they're radiologic. We are a breast center certified, and we're very happy to get that designation about a year and a half ago. And we also are chest pain certified. So we are a full service hospital, and we are offering all those services as of Monday. So anything that you need can be scheduled, and there are no barriers. And the most important thing, I think, is not the services that we offer, but how you feel coming into the hospital getting those services. So I can share firsthand that we have dedicated staff and personnel to ensure that our hospital is safe. The cleaning and disinfecting is bar none. The appointment scheduling is easy, and we have slots available. We're screening everyone that comes in to make sure that they don't have symptoms and they don't have a fever. We still have temporary visitor restrictions in place, so we don't have visitors coming in and out of the hospital. We have our social distancing in our waiting rooms, and we do have off-site screening locations as well, including our Bourbonnais campus.
So that's a good question, a good segue. There are a number of people who have expressed that they are afraid to go to the hospital. And I've been told by some of our healthcare professionals, as you previously mentioned, this is something that really attacks the respiratory system. And so some of the healthcare professionals have shared with me that they're seeing people wait too long because they're scared to come into the hospital. So we know that some people are very apprehensive about doctors and needles and all those, that whole environment. We know that. But there's a level of fear associated with catching the virus from being at the hospital. And so can you talk specifically, you mentioned like that the cleaning, you all are doing a thorough cleaning, you all are enforcing social distancing. How can I be assured that if I show up at AMITA St. Mary's with whatever XYZ symptoms, I'm not going to contract something, COVID, and when I leave the hospital?
Well, I'm happy to share that our ER medical director today stated that, and I can quote her when she said, I think the fear has gone away, and the community has recognized how well prepared and protective we have been in this hospital because of the uptick in visits in the ER that were not COVID related. Our number of COVID positive and persons under investigations has remained low and steady. And we have very well isolated our COVID patient population from the other patients. And we have very designated paths through our hospitals so that there is no cross-contamination from a COVID patient to a non-COVID patient. And I think that has been the most significant driver to make sure that our hospital is safe for people coming in. So I can say honestly today, as a person that walks through the hospital, I'm primarily seeing personnel who have been who have been screened that are wearing masks, and I'm seeing patients that are wearing masks. And there is not a large congregate of anyone. So there is nice distancing of everyone as well.
Is AMITA offering testing? Are you setting up sites throughout the community to offer COVID-19 testing at this time?
So we have been working on a grant to do that. We here have been focused on the annex, and I think that has made the biggest difference. We started testing here on March 19th, and so before IDPH even allowed people to get tested without a prescription, we set that up so that anyone who had symptoms or contacts that went to their primary care doctor and got a prescription could come to our annex for testing. And we've continued that. And that has segued very well into now we have this new population of patients that now need to come in for their procedures, and they need to have their COVID testing 72 hours before they come in for their procedure. So we actually have hours designated for them in our annex from 8 to 10 in the morning to get their pre-op testing. And of course, we're asking them after they receive their test to leave and go home and self-isolate. And the question of testing has come up. We've worked through that a lot through our many playbooks and service lines throughout the hospital. But as a laboratory medical director, I can share that the COVID test, because we do not know the long-term immunity of the disease, we don't know if it behaves like chickenpox or if it behaves like the common cold. So once I test you today, that test is not valid 2-3 days from now when you're going to the grocery store or you're stopping by to go to work, because now you're exposed to others. So we can't test everyone every day. So that's why the daily screening is the most important way to be sure that people are safe coming into the workplace.
And speaking of the test, I had the test.
You had the test?
I had the test. One of the providers of the community partnered with the city of Kankakee, and they asked me if I would be one of the first swab that morning. And so a lot of people are really terrified about this test. And I think it's just the idea of having a swab put in your nose. And I'm sure you've been tested as well.
Nope.
You haven't had the test?
No.
Really? So the employees are not required to have the test?
The employees are screened.
Okay.
And if as a healthcare worker, if you want to be tested, you can be tested.
Okay.
But it is not required. And I can tell you, as we've been working through this on the command center for weeks, I have heard a mixed bag. There are healthcare workers that don't want to be tested, and there are healthcare workers that do want to be tested.
Have they expressed why? What their positions? Have they expressed that?
Some people don't want to be tested because if they're asymptomatic and they have to be furloughed for 14 days, they don't want to be furloughed. They want to come in and they want to help. And if they're asymptomatic and they don't have a fever and they're wearing a mask, their transmission rate is very, very low. And so, and the other reason is that I stated before, which is why I have not been tested, is that I don't have any symptoms. I have not had any symptoms. I check my temperature every day. I wear my mask when I'm around anyone else. And if I go down to the annex and get tested today, when I go home and I come back to the hospital tomorrow, that test could be negative tomorrow. But if I were to be tested 4 days from now, I could be positive. But we're not testing people every day. So there was an initial recommendation from IDPH that we test healthcare workers every 2 weeks, which from a data standpoint and from a laboratory medicine standpoint is not scientifically proven, because I could get a test today, contract the virus in 2 days, recover in 2 weeks, and get another test and actually be negative again, and no one would have ever known I had the disease. Yeah. So until we actually have antibody testing that is demonstrated to reflect that you actually had the disease and recovered, that's the only thing that's going to really give us that information. The diagnostic test does not give us that information.
Okay. So just for you all who, if you haven't had the test, as I stated, I did have the test. And it's very quick. They have you lean your head back. They put a swab in your nose. I'm the kind of patient that I want to know what you're doing to me before you do it. So I want you to explain to me what you're doing. And so she said, just lean your head back. I'm going to put the swab in, and it's going to go deep. And I said, and what does that feel like? And she said, it feels like you were in the pool and you got chlorine up your nose. And I would say that that's pretty accurate. Of course, none of us like that feeling. It's not something that we sign up for to do every day. But it's a very quick procedure, I will say that. So if people do want to get tested, we do have testing throughout the community, as Dr. Hill shared, the annex at AMITA St. Mary's, Aunt Martha's, Tuesdays, Wednesdays, and Thursdays from 8:30 a.m. till 2:30 p.m. And then Riverside is also coordinating testing sites throughout the county. So it's very quick. I don't even think it was 3 seconds. I mean, really, it's a feeling, it's an unusual feeling, I will say that, but it's pretty harmless, especially if you've had a baby. That's kind of my gauge when I'm nervous about something. I say I had 2 kids with no pain meds. If I can get through that, I can get through anything. So if you want to have the test, we just want you all to know that it is available in the community, and if you take advantage of it.
Yes, and if I can just clarify an important point. The testing recommendations have been very fluid over time. So the updated IDPH recommendation that came out was that they actually wanted the healthcare workers going into the hospital to be screened rather than tested. And they sent out that update last week, which was very important because we did not want to have our associates feel like they were being forced to be tested. So we were very glad that IDPH made that clarification.
Speaking of our healthcare workers, they are our heroes as well. We think of police and fire and our dispatchers, but especially in a time like this, our nurses, our doctors, those lab technicians, the people that are keeping the hospitals clean, the housekeeping staff, the materials management people that are making sure you have enough PPE coming in, the whole system, all of those people that make up that system. Right now, I want to say personally, thank you to all of you. And you are our heroes. How are they holding up, especially those frontline workers? How are they managing through all of this? Because most of them also have families that they're going home to or may be afraid to go home to. Some of them are raising children. How are they doing in terms of their mental health?
So I can share with you that the healthcare workers here at St. Mary's have very, very high spirits, and it's for 2 reasons. One, AMITA committed to not doing any cuts in staff or cuts in salary to our healthcare workers. And that has been a huge weight lifted from our staff, that even if they are not actively working in their area currently, that they are still receiving their pay. So that's first and foremost. And the second is what I have always felt at this hospital. I've been on staff since 2006. St. Mary's is a community hospital of team-driven people. When there's something that comes up or something that needs to be addressed, it's all hands on deck. Everyone comes together and just addresses it. When we had to set up the command center and the testing center, the time it took for us to come together as a group with nursing, ER physicians, our facilities, our environmental service team, everyone just came together and developed processes and did it so quickly, so efficiently, and so accurately that it gave us peace of mind for when that first COVID patient came. So I have to say, I can still see the smiles through everyone's masks going through the hallway. And anyone who's been to St. Mary's in this community, I hear everyone say the same thing. There's something special about walking through the hallways of St. Mary's. There is a feeling of history and compassion that is not felt. And early in my career, I worked at 6 different hospitals. Many of them were also non-for-profit, faith-based hospitals, but no hospitals like St. Mary's.
Okay. We've heard some rumors, there's been some articles out about vitamin, either a multivitamin or vitamin D or vitamin C. Is there any science that supports that an increase in a multivitamin or C or D have a positive impact in combating COVID-19?
So none of the studies have been long-term to really demonstrate significant impact. But my mantra, and I think the mantra of most people in the realm of nutrition, is that it is always good to take a multivitamin, and it's for a myriad of reasons. The first and foremost is that our soil does not have the same mineral content that we think of our forefathers farming in early America. It simply just does not have the same level of nutrients. And also, most of us are not working outside anymore. We're working inside. And so we do not get the sun exposure that we used to. Mm-hmm. So it has always been a recommendation for people to take some kind of multivitamin. Anytime you're taking vitamins, though, you do want to be careful to make sure that you don't take too much. So I always recommend that when people are taking anything on a chronic basis, you make sure you're letting your doctor or your primary care provider know that, so they know what you're taking and how much you're taking.
You mentioned sunlight, so that's our vitamin D, which most of us are low in, just because of the reasons you said. We don't work outside and get much sun exposure. Okay.
Yes.
Cheryl says, are tests only for Kankakee residents?
Or what tests only?
The COVID-19 tests, are those only for Kankakee residents?
Are you referring to the testing we do in the annex?
I would. She didn't clarify, but I would say no if it's at the hospital, because you treat everybody.
Right, exactly. So no, there is testing going on throughout the entire state of Illinois, and you can get tested near where you live, or you can get tested near where you work. I think the website for IDPH lists all the different locations that you can go to get tested.
And IDPH is the Illinois Department of Public Health. Yes. Does St. Mary's have a number where people can call for support?
Yes, we do have a hotline number, and let me give that to you.
Okay, I'm going to write it down as well. Okay.
815-928-6431.
Okay, I'm going to have you repeat.
815-928-6431.
Okay, 928-6431. So if anyone has questions about COVID-19 resources and supports, they can call that number.
Yes.
Okay. What can you tell us about the antibody test? So just to keep everyone, put this in perspective, we know this is a novel coronavirus. This is one that we haven't seen before. So we've only been dealing with this for a very short amount of time. It's now May, not even a full year. So we're hearing some discussions about people may have already started to develop immunity to it. I've heard a lot of people say, well, I think I had it last, November, December. I was really sick. And so people are starting to suspect that there may be immunity in the population already. What can you tell us about the antibody test?
So the antibody testing is available now. We actually started having it be orderable for our physicians last week. So right now, the antibody test is most useful for people who are donating for convalescent plasma. And that has been a huge blessing to many hospitals. We were able to transfuse a few patients here, and we've been getting units pretty much every day now from the blood centers. So the patients who have recovered from COVID-19 are able to donate their plasma because it has the antibodies, and then those units are able to be transfused to another patient that's actively sick right now. So that right now is a proven benefit to the testing that's being done, and that's usually done by the blood center once you recover. For the general population, the antibody test right now is we don't know what it means just yet. They really just started testing for IgG and IgM. IgG is the immunoglobulin that detects you having the virus for a long period of time. IgM is usually a representation of you having the disease acutely. In COVID-19, we don't know what that means yet because people have not had the disease long enough for us to really study what those numbers will mean. So we're hoping that as more people get tested, we can trace back to those who have antibodies and see if they were around someone else, particularly like a healthcare worker, did they contract the virus again? Now, there have been reports in other countries that someone who had COVID-19, they were able to contract it again. We have not seen any studies that have shown that consistently here as of yet. So I think it's going to take some time for us to really know the utility of the antibody test. But for right now, the most important utilization of the antibodies are for people to donate for convalescent plasma.
So what is that test like? If I want to get tested, first of all, can anybody just say I want to see if I have antibodies?
No. So this should be a conversation that you're having with your primary care physician, and they will determine whether or not you need the test.
How do they test you? It's a
blood draw.
It's a blood draw. Okay.
Yes, and so for people who want to donate plasma, they would reach out to the blood center. And here in Illinois, St. Mary's utilizes Versity Blood Center. And if you call and have meet the screening criteria, then they will actually test you there to see if you can donate for convalescent plasma.
Okay. Can children get that test?
I'm not sure at the current time whether children can get the test. I would have to say, again, have them talk to the pediatrician whether or not that's appropriate. I'm glad you mentioned the children. This is becoming an area of concern, I think, for all of us as we're seeing more children developing symptoms from COVID. One of them is the Kawasaki's disease, which is a vasculitis, which is actually very rare, but there have been several cases in New York. And we are seeing some children that have some symptoms of COVID-19. So that is definitely something that we want to keep an eye out and making sure that we're not assuming that children are immune from the effects of this virus.
When I introduced you, you have a dual title. You are the Chief Medical Officer and you're also the Laboratory Medical Director. So from your lens as a laboratory physician, what is a day like for you at work?
Oh, so now I get to talk about how fabulous pathology is?
You do.
Yes. So for me, I am board certified in what's called anatomic and clinical pathology. Anatomic pathology basically is looking at the slides for tissues that are removed. So if you have a biopsy, you have a breast core biopsy, or you get a colon endoscopy and they remove a polyp, or if you have a larger resection like a mastectomy where they remove your breast or take out a kidney or take out a colon, then I would receive that specimen, do an evaluation, turn that tissue into slides, look at it under a microscope, and diagnose whether there's cancer, whether there's an inflammatory process, and then I generate a report that is given to the physician so that they can determine next steps of treatment with the patient. So that is anatomic pathology. Clinical pathology is what COVID-19 falls under, and that is all the laboratory blood work, nasal testing, like you said, the nasopharyngeal swab, any swab testing that are done looking for viruses or bacteria, or chemistries, looking at your CBCs, your white count. All of that is clinical pathology. So in the course of the day in Kankakee, because we are a community hospital that will serve any patient in our community, we are open door, serving the most vulnerable in our community. So at any given day, there are a variety of patient diseases that I diagnose via either clinical medicine or via anatomic medicine as it relates to pathology, and giving those diagnostic data points for the physicians to determine next steps.
Wow.
It is pretty fabulous. I love it.
So how long were you in college? Like 15 years?
Yeah.
Because if there are kids watching this and you want to be a doctor and you think you have some interest in this, I just want to keep it real with you guys. So a lot of chemistry, I would take it. It sounds like a lot of chemistry.
So actually, it's not. So you do 4 years of college,
Okay.
and it's usually most schools have a pre-medicine track, and so they tell you exactly what classes you have to take. Then there's 4 years of medical school, and that's where you're learning some of your basics. Biochemistry is one of them, but you're also doing physics, you're doing pharmacology, so there are a lot of different classes that you have to take. And then you're also doing clinical, so you get to go to a clinic and you get to interact with patients, and then you also get some time in labs. And so having that varied experience usually has people between their third and fourth year of medical school determining what specialty that they want to do. And I was fortunate enough to have a very robust laboratory faculty at my medical school, and they attracted me into the field of pathology. And so I was able to do a rotation at Northwestern and fell in love with the specialty and actually went there to do my residency. So residency after your 4 years of medical school, when I did my residency, it was 5 years. Now it's 4 years, but you do get paid in residency. So it's not.
So this, we're on 12 years right now.
Yes, but you do get paid in residency.
This is commitment, folks.
It is commitment. So it's now 4 years, but most people who do pathology as a residency do a fellowship. So it can be anywhere from 4 to 6 years. And then you get your first real job, usually around age 31 or 32. That's correct. But the caveat to that is when you go through all of those steps and it's for something that you're passionate about, 20 years later that I've been in practice, I love what I do every day. And I don't think that's something that I would have wanted to rush through. I have a foundation that I can look at every biopsy and have confidence that I am accurate, and also knowing when you don't know something and having colleagues to reach out to share cases with. So I think anything that's worth having takes time. And if you're blessed with time, use it to do something that you're passionate about.
Those are great words. Thank you. So I just want to thank everybody for tuning in with us this evening. We are going to continue to provide updates and resources. If there is a specific topic that you feel like you would think that you would be able to benefit from having someone speak about, let us know. Feel free to reach out to us. We do have several people that, send us messages and comment on our social media. So I just want to make sure that, especially during this time, we're doing everything we can to get you information and resources. I want to make sure that you all have access to credible resources. Social media is not the news. It's people's opinions. Sometimes people do share, articles and information, but for the most part, it's a lot of people's opinions, and it's really important, especially as we're dealing with a health issue like this, that you all have access to data and credible information. So if there's a topic or something of interest that you think would be helpful, please let us know. I want to thank Dr. Kalisha Hill for joining us. And just a reminder that the state of Illinois has a COVID-19 hotline number as well. So AMITA St. Mary's, their hotline number locally here in Kankakee is 815-928-6431. Again, 815-928-6431. Again, the state of Illinois has a hotline number, and that number is 1-800-889-3931. Again, 800-889-3931. If you contact the state of Illinois, you are able to get your questions answered 24/7. We here at the city continue to follow our healthcare professionals. Again, we're fortunate to have 2 hospitals, so I encourage you to follow the pages for AMITA St. Mary's Hospital, Riverside Healthcare, and of course our Kankakee County Health Department. The health department is the entity that tracks all of the data specifically related to our COVID-19 cases. If you would prefer to use the internet, www.coronavirus.illinois.gov, and that has the most up-to-date information regarding COVID-19 as well. So again, Dr. Hill, thank you so much for taking the time to join us. I know you are very busy at the hospital, and it sounds like at home. You said you had twins. So thank you so much for taking the time to talk with us this evening. Take care of yourself. We'll keep all of you guys in prayer, our healthcare workers. You guys be safe and be well.
Thank you so much. It was my pleasure.
Okay, we'll connect soon. Before I leave, I am going to be on Chicago Tonight with WTTW. I was contacted to do an interview this evening at 7 p.m. So if you all want to tune in, I'll be speaking with one of their reporters regarding the city of Kankakee and how we're handling COVID-19. So again, that's Chicago Tonight on WTTW tonight at 7 p.m. Thank you all for tuning in with us, and we look forward to connecting with you soon.